Okay, today we're gonna have a video on a deep tendon reflex. And before I begin my examination, what I want to do is hand sanitize and introduce myself to the patient. And again, this deep tendon reflex is specifically important for pregnant ladies. And what we're actually doing is checking for like the lower motor neurons and how they work in specific. If we're checking for, say, like the brachial, we want to see how the C5 and C6 specific nerves are working, making sure they're working accordingly. Also, there's a grading scale with this. The grading scale is a 4 plus, which consists of hyperactive or clonus. And then we have a 3 plus, which consists of brisker than normal or hyperreflective. And then we have a 2, which is considered normal, a 1, which is diminished or hyporeflective, and a 0 scale, which is equals to absent. So I hand sanitize, I explain what I'm going to do. I introduce myself to the patient to identify, I ask them for their name and their date of birth, and I make sure that it's all correct. Hand sanitize, and I will now start my checking for my reflex of my tendon. The first one I'm going to check for is the bicep tendon. And the bicep tendons consists of the C5 through C6. And to locate this tendon is right below the bicep muscle in the antecubital area. And what I want to do is have my patient arm out like this. And what we're looking for is contraction of the bicep and flexion of the forearm. So I want to find that tendon. And so we should see contraction of the bicep and a slight flexion of the forearm. Okay, next we're going to move on to the brachial radials. And this is, we found the brachial radius, the brachial pulse right here, and above 2 inches above the brachial pulse, which is about right here. We're going to be checking for the brachial radial pulse. And what we're looking for is the hands to supinate and a slight flexion of the forearm. So the hands supinate and just a slight flexion of the forearm. And that one consists of the C5 through C6, just like the bicep tendon, which was C5 through C6. Next, we're going to move on to the tricep tendon. This consists of the C7 through C8. And here I want to have my patient just relax their arm, like so. And we want to find the tendon. The tendon is right above the elbow. And what we're looking for is extension of the forearm and a slight flexion of the tricep. Okay, slight flexion here, extension here, and slight flexion on the triceps. Next, we're going to move on to the patella tendon. The patella tendon is right below the kneecap, and this consists of the L2 to L4. And what we're looking for is we just want to see that the patient foot extend forward. So we just tap on the patella tendon, and as you can see, next we move on to the ankles. And while we're here, before we check the ankle tendon, we want to check for clonus as well. So to check for clonus, what I will do is hold the patient leg here, and I will dorsiflex the feet up and release it, and that's a normal sign. If this was abnormal, once I dorsiflex the feet up and I let go, the feet will actually charge to bounce like this quite a few times. It'll bounce like this. That's a positive sign for clonus. Okay, so now I'm going to continue on, and I'm going to be checking the Achilles tendon. And the Achilles tendon consists of the C5 through the S2. And again, what I want to do is dorsiflex my patient foot upward. And once I hit on the tendon, I want to see the foot plantarflex forward. So there we go. And I can actually feel it flexing forward also. Okay, so it looks like I'm all done with my tendon, reflex tendon. From here, I would hand sanitize, document everything I did in the Mars, and I am done.